As the nation fights the opioid epidemic, there's a predicted shortage in the number of healthcare professionals that will be able to help people fighting addiction. On the federal level, there are proposals to recruit doctors and those who work in behavioral health. Carol Lee McGrath sat down with Dr. Robert Roos, the Vice President of Mercy Behavioral Health, to find out more about the need.
Clearly, we've had an expanse for the need for treatment, individuals receiving behavioral health treatment, both psychiatric and mental health disorder treatment, but also addiction treatment. And we're currently amidst, but facing an even greater shortage of providers to meet the demand for care, to be able to, to provide care for the people that need it.
And this is something that maybe people are not thinking about, because you're talking about adding beds, and that's like a big area of concern and focus, of course. But you need somebody in there to be able to manage those patients.
Absolutely. Workforce is critical. This is a people-oriented service that we provide to folks, and you need to have trained professionals in order to do it. One of the statistics that is quite glaring when people think about the workforce shortage is that over 55% of psychiatrists are over 55 years old. Wow. And so as we think an aging population, a growing population, and then also a population now that we know has growing behavioral health needs, that speaks to just what we're looking at as we look to the future. And that doesn't even mention the fact that we still need a growing level of expertise in treating the disease of addiction as well.
Okay, so there's a new federal proposed legislation by Congresswoman Catherine Clark, who's from Melrose, Mass., to encourage people to enter the field. And it basically involves a loan repayment program for those who commit to working in high-need areas for 6 years. Do you think this would be effective?
I think it's an important part of the solution, and the reason why is that in order to effectively address what we need in terms of workforce, we need to both broaden our workforce and who we think about in terms of our workforce, like peers and recovery coaches, but we also need to support the existing workforce and attract more people into the field. And having loan repayment programs can be a very effective way to do this, because as you think about making the decision to go down a career of service in health professions, you're oftentimes looking at hundreds of thousands of dollars of debt, student loans, and you look at a discipline in a field that has historically been underpaid, underappreciated, and where the salaries really just haven't kept up with the rest of the market, the rest of the business. And so to tap into what really is mission-driven work in a lot of cases, to provide that support by allowing individuals to tap into loan repayment programs can be a very effective way to mitigate some of that risk and some of that debt, and really inspire people to take that next step.
Talk a little bit about the number of people involved in treating somebody with an addiction problem.
Yeah, this is truly a field where it's important to recognize that it's a biological, psychological, social, and spiritual disease, right, that impacts all aspects of somebody's life. So when we construct treatment, the treatment involves disciplines involves members of all different disciplines, right? And so typically on a treatment team of somebody who's receiving behavioral health care, it involves a physician, oftentimes a psychiatrist or an addiction specialist, a psychologist, a social worker, or a master's prepared clinician to really work with them on the individual clinical aspects, a nurse in many cases, particularly if medication is involved, recovery coaches or peer supports, and then a whole complement of other sort of administrative and support folks to really help somebody along in their treatment.
Because recovery is forever. I think people sometimes don't realize the number of people involved in helping that person.
Absolutely. I mean, recovery is a process, one where you're continually trying to strive to improve yourself and increase your wellness. And it's important that we attend to all those dimensions of somebody's life in the treatment. And so having a multidisciplinary team as we address behavioral health is critical to its success.
And how do you deal with things like turnover in this field? Obviously, this is not an easy field. So if I were to say to my niece who's getting her PsyD, hey, listen, maybe this is something you should consider. How do you encourage kids in that field or thinking about this, and also how do you discourage turnover?
It's a great question, and it can be a challenge sometime, but really, as a provider myself, you recognize the rewards in this treatment very quickly when you start to see people access care and improve their life. It can be a transformative experience. So what I would do is encourage individuals to actually gain experience in shadowing or working in the field to see what successes there are, and then to build within oneself resiliency, ways of coping, and ways of kind of understanding how you relate to people and relate to the world, because instead of having that energy drained at the end of the day from hearing sometimes very complicated and chaotic or traumatic stories, you can leave the day feeling energized by what you've done to be able to help somebody cope better with what they're going through.
And you have been a leader in this area, combating the opioid crisis, involved in so many different aspects. I know that the numbers are down as far as the number of opioid-related deaths from 2016 to 2017, a 6% decrease, but still you have 2,100 deaths. What kinds of things would be your highest priority as you look at 2018 into 2019?
So it continues to be some of the same things that have led to this early success, which is expansion of naloxone, the opioid overdose reversal agent, expansion of treatment, particularly with medication treatment. And then really what I would say now is you need to continue to double down and focus on the individuals that are highest risk. Those that are released from incarceration, those that are being released from detox or inpatient facilities, and those that are leaving medication treatment, and particularly communities of color and pregnant women. Focusing resources on those communities in ways that attend to their needs, I think will continue to show rewards and continued success as we address this crisis.
And how do you encourage families who are going through this right now with their loved ones who might be so discouraged or so worried about, what the future holds?
It's not easy, and this is clearly a family disease. And so I certainly always recommend that people find support through established networks that exist, through organizations that are designed to help family members grieve, advocate, and educate each other. In our area, we have many of those. One in our state and in the broader region is Learn to Cope, which is an excellent resource for folks, holds meetings every week right here in Western Massachusetts over at Providence Hospital in Holyoke. And I would recommend that people seek out resources from others that have been through or are going through similar experiences to gain and learn the tools that they have, and to find a space to understand that they're not to blame, and there's things that they can do to help themselves and to help their family member.
All right, Dr. Robert Bruce, thank you so much for coming in.